There is a moment that happens quietly inside the body somewhere after 60, and almost nobody ever feels it arrive. It does not announce itself. There is no ache, no warning twinge, no flashing signal that something has shifted. And yet it has. The very same pill you have swallowed every morning for years, the one your body absorbed without complaint, can quietly begin behaving like a completely different substance. Not because the pill changed, but because everything around it did. The body receiving it, processing it, reacting to it. That quiet shift can sit somewhere between protection and risk, between stability and a slow, invisible buildup towards something far more serious, a heart attack, a stroke, a sudden event that seems to come out of nowhere but never actually does. What makes this so dangerous is that nothing feels wrong in the beginning. No pain to point to, no clear signal in your chest, no moment where your body taps your shoulder and says, "Pay attention." Just a silent shift happening underneath the surface day after day while everything on the outside looks normal. That is exactly why this matters, because we are about to walk through 5 specific kinds of medications that, after 60, have been linked to a rising risk of cardiovascular events, especially when taken the same way they were taken decades earlier, without anyone stopping to ask whether that still makes sense. This is not meant to frighten you. Fear is not useful here. What is useful is understanding what is actually happening inside your body right now, today, so that you can make sharper, more informed decisions going forward. And stay with this all the way through, because one of the 5 medications we are about to discuss is something millions of people take every single day without ever questioning it. By the time we reach that one, you may find yourself looking at your own daily routine in a completely different light. To understand why these risks climb after 60, you first have to accept something most people are never actually told. Your body no longer processes medication the way it once did. That single fact changes almost everything that follows. As the years accumulate, several systems inside the body begin to slow, quietly, without fanfare. The liver becomes less efficient at breaking down medications, and the kidneys lose some of their filtering power. The result is that drugs linger longer than expected, and a completely normal dose can start to behave like a much higher one, simply because your body is no longer clearing it at the old pace. There is also a change happening inside your blood vessels. Arteries that were once flexible begin to stiffen, the inner lining grows more sensitive to stress, and the delicate balance between clotting and bleeding becomes harder to maintain. So when a medication interacts with any of these changing systems, even slightly, the effect can be amplified in ways it never used to be. This is precisely where people get misled, because the medication itself is rarely the villain. It may have been entirely appropriate when first prescribed and may even still be useful today. But the surrounding context has changed, and in medicine, context is everything. A dosage that made sense at 50 can be excessive at 70. And yet prescriptions are often continued year after year without ever being reevaluated, not because doctors do not care, but because these changes unfold so gradually that nobody thinks to look again. Here is where things start to feel more serious. After 60, the baseline risk of cardiovascular events naturally climbs. That much is already expected. But when certain medications sit on top of that rising baseline, especially without adjustment, they can push that risk even higher, sometimes subtly, sometimes significantly, and very often without a single obvious symptom until the moment something actually happens. Before the first 2 medications, hold on to one idea. Nothing here is a suggestion to stop any medication on your own. The point is awareness, because once you understand how something works inside your body, you stop drifting along on autopilot with something that may need a second look. The first layer of risk begins here, because the first 2 medications we are about to walk through are among the most commonly used substances on the planet, especially past 60. Swallowed daily without hesitation, widely assumed safe, yet under the right conditions, they can quietly raise the strain on your heart, nudge blood pressure the wrong way, or interfere with blood flow through vessels already more delicate than before. This was never really about the pill itself. It was about timing, dosage, and how dramatically your body has changed beneath the surface. The first category is a group of drugs known as nonsteroidal anti-inflammatory medications, including common names like ibuprofen and naproxen, along with several prescription strength options. They are reached for constantly, for joint pain, back pain, arthritis, the everyday aches that come with simply living in a body for a long time. For many people, they feel almost effortless. You take one, the discomfort fades, and you move on. Underneath, something else is unfolding. These medications work by blocking certain enzymes that drive inflammation, which is what eases the pain. But those same enzymes also help protect your blood vessels and keep blood flow steady. After 60, your vessels are already less flexible and more sensitive to stress. So interfering with that protective system can lead to a subtle tightening that pushes blood pressure upward, often without you noticing. At the same time, these medications can affect how your kidneys manage fluid balance, encouraging the body to hold onto sodium and water, adding further strain onto an already working heart. Picture both of those things happening at once: rising blood pressure and rising fluid load, layered onto a system already working harder because of age. Multiple large studies have linked long-term use of these medications to a measurably higher risk of heart attack and stroke in older adults. The relief is instant, but the damage builds in silence. None of this means the medications are bad, only that daily long-term use nobody ever revisits after 60 is where the danger quietly begins to build. That brings us to the second medication, even more subtle and even more overlooked than the first. This is a class of drugs called proton pump inhibitors, used to reduce stomach acid, including common names like omeprazole and esomeprazole. They are routinely prescribed for acid reflux and heartburn, especially in people already taking other medications that might irritate the stomach lining. On the surface, they appear completely harmless. But here is where the picture becomes far less simple. Stomach acid is not just an annoyance to be suppressed. It plays a critical role in absorbing key nutrients, particularly magnesium, calcium, and vitamin B12, and long-term use of these acid-reducing drugs can quietly reduce that absorption. That connects directly to heart and stroke risk. Magnesium keeps heart rhythm stable, and low levels raise the risk of irregular heartbeats. Calcium balance affects vascular function, and B12 helps maintain healthy vessels and nerves. When these levels are quietly disrupted, the entire cardiovascular system becomes more vulnerable. Some research even suggests long-term use of these drugs may interfere with the endothelium, the thin inner lining of your blood vessels that regulates flow, clotting, and relaxation. When it stops functioning properly, the risk of vascular events climbs, slowly and quietly. Many people start taking one of these medications for a short-term issue and then simply continue for years without anyone circling back to ask whether it is still needed. It feels safe, it was prescribed, nothing seems wrong. But the longer it continues without review, the more these underlying effects quietly matter. And sometimes the answer is not to stop entirely, but to adjust the duration or explore a lower dose, something that can only happen once somebody actually asks the question. What we have covered so far is only the first layer, but what comes next goes even deeper, because the next two medications do not just nudge blood pressure or shift nutrient levels from a distance. They interact directly with how your heart functions, how your blood actually moves, and how your entire system responds under stress. And in many cases, the effects are not immediate at all. They build slowly across months, sometimes years, which is exactly why they slip past so easily. The third category is a group of medications commonly used to manage sleep, anxiety, or an overactive nervous system known as benzodiazepines, with familiar names like diazepam and lorazepam. They work, they calm anxiety quickly, they help people fall asleep. And for many people, particularly later in life, they start to feel essential rather than temporary. Here is what is happening underneath that calm. These medications slow brain activity, which produces the calming effect, but that same slowing spreads beyond the brain, dampening breathing, reaction time, and coordination. As the body ages, it grows more sensitive to these medications. They linger longer, accumulate more easily, and their sedating effect grows stronger even at the same dose, often leading to reduced physical activity and less movement throughout the day. That matters more than people guess, because circulation depends on movement. When movement decreases, blood flow becomes less efficient, clot risk rises, and oxygen delivery to tissues becomes less reliable. These medications can also worsen breathing during sleep, including conditions like sleep apnea, and when oxygen levels dip repeatedly through the night, it places additional strain directly on the heart. Stack it all together, reduce circulation, lower oxygen, a system already more vulnerable due to age. None of it feels dramatic. It feels like fatigue, like slower mornings. But underneath, the system is under far more strain than it should be, and the danger comes not from the medication itself, but from taking it continuously without ever reassessing it as the body keeps changing. That brings us to the fourth medication, where things grow more complicated, not because of what the drug does alone, but how it interacts with everything else already happening inside the body. The fourth category includes certain decongestants and stimulant-like cold medications, including those containing pseudoephedrine, reached for constantly during colds and seasonal discomfort, and remarkably easy to access, which makes them feel inherently safe. But the mechanism works differently than people assume. Decongestants constrict blood vessels, which is exactly what reduces nasal swelling, but that effect does not stay confined to the nose. It spreads through vessels all over the body, including those feeding the heart. Blood pressure rises, heart rate can climb, and the heart has to push harder through a tighter system. After 60, with arteries that have already lost elasticity, that added constriction can become genuinely significant, especially for someone with elevated blood pressure or other heart medications already in play. This is exactly where combinations turn dangerous, because most people are not taking just one medication. A blood pressure pill here, a pain reliever there, something for sleep, and then a decongestant added on top during cold season. Individually manageable, together they interact in ways nobody planned for. One raising pressure, another shifting fluid balance, another slowing the system, and the body compensating for all of it at once. Here is where people get caught off guard, because the trigger event often feels sudden, but the buildup behind it has usually been there for a long time. A slow accumulation of stress on a system that had been quietly compensating for longer than anyone realized. This is why awareness matters, because once you understand how these medications interact, you begin to notice patterns you never noticed before. That brings us to the final piece. One more medication left to discuss. This one stands out not because it is rare, but because it is the opposite, incredibly common, used by millions, and almost never questioned. Once you understand how it interacts with the body after 60, it genuinely changes how you look at it. The fifth medication is low-dose aspirin. For years, it was widely recommended as a simple way to protect the heart. A small daily dose, often called baby aspirin, was believed to help prevent heart attacks and strokes by reducing the formation of blood clots. And in certain specific situations, that belief still holds true. For people who have already survived a heart attack or stroke, or who carry particular high-risk conditions, aspirin can still play a genuinely protective role. But here is where the picture has shifted. More recent research shows that for many adults over 60 who have never had a previous cardiovascular event, routine aspirin use may not deliver the benefit once assumed, and in some cases may actually raise risk. Aspirin reduces the ability of platelets to stick together, preventing clots, but clotting is also a vital protective mechanism your body relies on to stop bleeding when a vessel is damaged. After 60, blood vessels grow more fragile, and the balance between clotting and bleeding becomes far more delicate, so aspirin can raise the risk of internal bleeding, particularly in the stomach or brain. There are two fundamentally different types of stroke, one caused by a clot-blocking blood flow, the other by bleeding inside the brain. Aspirin lowers the risk of the first while raising the risk of the second. After 60, without a clear prior cardiovascular history, that balance can tip the wrong way, and for some, the bleeding risk quietly begins to outweigh the protective benefit, exactly what more recent clinical guidance has started to reflect. Many people started taking aspirin years ago based on guidance that was standard at the time and simply kept going. No reassessment, just continuation because it felt safe. But medicine evolves. None of this means aspirin is bad. It means it must be matched to the right risk profile, the right individual, and taking it just in case without knowing whether it genuinely benefits you can quietly add risk without delivering real protection. Here is the shift that ties all of this together. 5 very different medications, 5 mechanisms, but all sharing one thing: their risk climbs precisely when taken the same way year after year while the body underneath keeps changing. Control comes back into your hands here because the most important step was never stopping everything at once. It was understanding what genuinely needs to be reevaluated and when. A few practical steps actually make a real difference. Review your medications regularly, not only when something has gone wrong, but proactively, asking whether you still need the same dose, whether your risk profile has shifted. Pay close attention to combinations, since many risks come not from one medication alone, but from several interacting at once, including over-the-counter options. Watch for subtle signals rather than dramatic symptoms: increased fatigue, shortness of breath, unusual dizziness, shifts in blood pressure readings, since these are often the earliest indicators something needs another look. And understand that your body is not fixed. What worked 10 years ago may not be ideal today, and that is simply part of how a body evolves. If there is one single idea worth carrying away from everything we have just covered, it is this: the real danger was never the medication itself. The real danger is continuing to take it exactly the same way while the body underneath it is no longer the same body at all. Because past 60, your body is not simply an older version of itself. It processes substances differently, responds differently under stress, and tolerates imbalance far less easily. Small mismatches can carry a far larger impact than they would have years earlier. So many people unknowingly fall into a quiet pattern, doing what has always worked, trusting what has always been prescribed, never realizing the surrounding context has shifted underneath them. This was never about anyone doing something wrong. It was simply never explained clearly in the first place. In medicine, there is an idea that rarely gets the attention it deserves. Not everything needs to be added. Sometimes things need to be adjusted, reduced, or reconsidered entirely, and that ongoing process is every bit as important as starting any treatment in the first place ever was. This becomes genuinely empowering rather than something to fear, because once this principle settles in, you stop viewing medications as fixed fixtures of your life and start seeing them as tools, matched to the right time, suited to the stage of life you are actually living in. When that alignment holds, the tools help. The moment it drifts, even slightly, that is exactly where risk quietly begins to build. Think back across the 5 medications. Pain relievers, helpful for inflammation, yet capable of raising blood pressure and fluid retention long term. Acid-reducing medications, useful for the stomach, yet capable of disrupting nutrient balance and vascular function. Nervous system calmers, helpful for sleep and anxiety, yet capable of reducing movement and affecting circulation. Decongestants, effective for sinuses, yet capable of tightening vessels throughout the body, and aspirin, protective in the right context, yet capable of raising bleeding risk without clear indication. Each one carries real value and real purpose, but also a threshold, a tipping point where the balance can shift the wrong way. That threshold is never fixed. It moves with age, with other medications, with lifestyle and underlying conditions. This is why awareness matters more than anything else, because awareness leads to better questions, and better questions lead to better decisions. Here is something simple, yet remarkably powerful. At your very next checkup, instead of focusing only on new symptoms or new prescriptions, ask one different question. Is everything I am currently taking still appropriate for me at this exact stage of life? That single question changes the entire conversation, shifting the focus from constantly adding to carefully evaluating, from simply reacting to actively optimizing. And very often, it opens a door toward adjustments that genuinely reduce risk without ever removing support that is still truly needed. Your body sends signals constantly, not always loud ones, but consistent ones, and learning to notice them makes a profound difference. A subtle increase in fatigue, energy draining faster than before, lightheadedness when you stand, shortness of breath during activities that used to feel effortless. None of it is dramatic alone, but together it is meaningful, often the earliest sign that something needs attention. Paired with regular review, that awareness builds a level of control over your health that very few people ever develop. And here, finally, is where everything comes together. The real difference between reacting to a heart attack or stroke after it happens and quietly preventing one before it ever does almost always comes down to small adjustments made early. Not one dramatic intervention, but a steady series of small, informed decisions that keep the system balanced. You cannot control every risk factor stacked against you, but you can control your awareness, whether you ask the right questions and whether your routine still matches the body you actually live in today. That, in the end, is what makes the difference. Not fear, not avoidance, but alignment. And if any part of this made you pause and look at your own daily routine a little differently, that pause is worth holding on to, because sometimes the most important changes in a person's life begin with nothing more than a quiet realization that something which worked perfectly well before may simply need to be looked at again with fresh eyes at this new stage of life. And once that realization settles in, the way you make decisions about your own health never quite looks the same again.